Safety first. Management of any cataract without the use of a sharp chopper. To label a cataract being phacoable, it is vital to be able to chop the nucleus into multiple equal-sized fragments. In this chop here, a Sinskey hook is used instead of a sharp chopper. You will notice that both the phaco tip and the Sinskey stay inside the rhexis margin and they exert an equal and opposite force, leading to a complete crack in the nucleus. So firstly, we need a circular rhexis with perfect hydrodelineation, which makes the nucleus spin around like butter. The secret to a complete chop in every attempt is the correct depth and angle of approach. This is where the central well comes in picture. The phaco tip should be anchored in the very center during the entire emulsification process, and the fragments are nudged towards the tip using the other instrument. If at all the tip needs to go towards the rhexis or under it in the peripheral zone, we need to make its bevel up while doing so. To execute all these movements seamlessly, it is essential to maintain centration of the eye in the microscope view with a good red reflex during the entire surgical process. Lastly, we always have to make sure that the anterior chamber is well formed, and injecting viscoelastic substance before bringing out the phaco probe is a good practice. The central well should be beyond the center of the nucleus at around 70 to 80% of the depth in order to get a correct angle of impalement. A slight amount of phaco power is applied to bury the exposed tip into the central wall of the well, and the Sinskey, after being placed close to the tip, exerts a force in the opposite direction. We take advantage of the lamellar orientation of the lens fibers, which allows easy manual separation of the natural fracture planes in a dense nucleus. We are demonstrating this technique in grade 2+ cataracts and moving on to higher grades of nuclear sclerosis. Staining the anterior capsule helps in deciding the width of the central well and also helps in demarcating our Lakshman Rekha of safety, beyond which both the instruments are prohibited to pass through. This technique is extremely safe as the rhexis margin is never crossed. It has minimal stress on the zonules and the nucleus is cracked within the bag itself. The phaco energy used to create the well is at a much lower plane, and because these multiple equal-sized fragments are being nudged in the center, they occupy the superior empty space of the well, which keeps them at the anterior capsular plane. This results in immediate post-operative clear corneas even in dense brown cataracts. A point to remember is, more the number of fragments, less will be the power used to emulsify them. We can decide on how many nuclear fragments we want to create in every case depending on the density of the nucleus. Hence, the overall phaco energy consumption in this technique is significantly reduced for the entire emulsification process. In denser cataracts, the central well needs to have a well-defined depth. It helps in achieving a complete antero-posterior crack. The well can be wider in size if required, as there is ample peripheral nuclear core remaining for a proper hold during the chop. Another important point in harder cataracts, especially the leathery kinds, is to have a multiplanar approach of the Sinskey, where we need to separate the fragments layer by layer going into deeper planes unless we see a complete crack till the base of the nucleus. This should be performed while the exposed phaco tip is embedded into the walls of the central well, reaching to around 70 to 80% depth, and during the entire chop there is sufficient vacuum being constantly applied, which not only stabilizes the nucleus but also prevents it from going into the periphery, hence avoids any stress on the zonules. This technique is pupil independent as only the central nucleus core is attacked here. So cases having small pupils or a compromised view in the periphery are best served using this approach. The emulsification occurs piece by piece at the anterior capsular plane. A safe idea is to move towards the iris plane and switch to epinucleus mode at the time of emulsifying the last nuclear fragment. If the depth of the central well is correct, we will be able to conduct successful chops without catching the iris in spite of the pupil being extremely small. Nudging the pieces towards the centrally anchored phaco tip helps in such cases. When it comes to mature cataracts, performing the chops using the central well is a piece of cake, and ironically, it looks like cutting pieces of a cake due to the arrangement of the cataractous lens fibers, which completely separate with almost negligible force. Finally, developing these solid rules and inculcating these textbook habits in our surgery will exponentially reduce the risk of complications and deliver consistent results to our patients.